Okay, so today's question is what is ATC, automatic tube compensation? So how different this mode is. So understand that this is not a typical mode, it's a setting which is available in certain modes. And the only modes in which it is available in which the patient is breathing spontaneously. It is not available in modes in which there is assist control or control mode ventilation. It's only available in which the patient takes an effort on the ventilator to take a breath and exhale a breath. So what happens? We all know that there is a tube which is endotracheal tube or tracheostomy tube. These are the two tubes, and these are of varying sizes. And during inhalation, the patient has to suck the air when the patient is breathing inside, and has to exhale the air to this tube. So it creates an extra resistance either in inhaling or in exhaling. So in pressure support mode, what we do is we put a little bit of pressure, which is a fixed pressure, which we apply to the patient, so that in pressure support mode, the patient is breathing with the help of that pressure. But in automatic tube compensation, what is happening that automatic tube compensation is a closed loop system, and it takes feedback of every breath and then adjusts the pressure support. So, on what parameters the pressure support is adjusted in ATC is one, the tube size, whether the patient is having an endotracheal tube or a tracheostomy tube. The pressure will be required more in endotracheal tube, and the pressure will required less in tracheostomy tube. Then, which type of tube, which size of the tube is, whether it's a 7 centimeter, 7 mm or 8 mm or 9 mm, or both, whether tracheostomy or endotracheal tube. Because if it is a narrow tube, more pressure is required. If it's a wider tube, less pressure is required. And third is the flow, how fast the patient is sucking the air and how fast the patient is exhaling. So these are the dynamic changes which are happening. So what is automatic tube compensation does is it calculates the amount of pressure required to put during the inhalation, and it negates during the exhalation. So what we do in ATC, when we put on the ATC in that particular mode, we tell whether the patient is having endotracheal tube or a tracheostomy tube. When we then we said what is the size of the tube, 7, 8, 8.5, and then we want to set how much percentage of compensation is required, whether 60%, 70%, 80% of what is pressure is required. So based on that, the automatic tube compensation adjusts the pressure support based on the tube during the respiratory cycle. So it's a slightly better as compared to the fixed pressure support in that. So it's not a mode, it's just a setting which provide an extra dynamic pressure support during the spontaneous modes of ventilation. I hope this clarifies. Do read more about it. Thank you.